respected members on the dais, well-wishers of CRRT, patients and their caregivers, and everyone else here. My namaskarams to you. Cancer is increasing at a steady but definite rate. When I joined the institute under chairman in 1992, it was around 90 per 1 lakh population. Now slowly in 2014, we have almost 108 to 110 new cancer patients per 1 lakh population. There are two reasons for this. One, we can look at it positively, that is, in a way that we are not dying of malaria, tuberculosis, heart problem, diabetes, stroke and hypertension. Somehow, our mortal body has to live, and hence, probability of cancer increases. As we age, mistakes collect in our cells, and more mistakes collect, and suddenly we get cancer. So, as we are an aging population now, initially we were dying at age of 32, about 60 years back. Now, the average longevity is approximately 66 years. And with the coming years, we are going to live longer. So, with increasing age, more chance of getting cancer. This is called as demographic effect. There is also another very important phenomena, that is the environment, the lifestyle changes which are taking place. So this environment and lifestyle changes also contribute hugely to the increasing incidence of cancer. So if you look at it, what are the things which we can do to reduce cancer? That is, A, we have to say no to tobacco in any form. 2, we need to look at some sort of exercise for 30 to 40 minutes every day. It will not only reduce the chance of getting hypertension, diabetes and heart problem, and also cancer. And our food should also have some amount of vegetable and fruit in it. The WHO has made a very important program that is called as 25 by 25. That means by 2025, they want to reduce the chance of death by non-communicable disease like cancer and heart problem by 25%. To strengthen the arm of WHO, UICC, which is a very major international cancer body, has started conducting and devoted February 4th as a World Cancer Day to sensitize the whole population, the individuals and governmental agency for early detection, screening, treatment and in palliative care for cancer. So this is the significance of this particular day. And then now the most important and pleasurable duty, that is to introduce my chairman, Dr. V. Shanta. Dr. Shanta is a household name. About a couple of years back, in the major magazine in India, they asked a young woman whom they look up to, and chairman was there in top 10. So basically she's known to everyone here. And all the awards which are important, like Padma Bhushan, Ramanan Magsaysay Award, the Avayar Award, you name it and chairman has it all. But from an oncologist point of view, my perspective, there are two important things which define Madam. A, she was a visionary in promoting a program for cancer education in India. So, a beneficiary of that visionary, of that vision is basically all of us, all the members of the trust have got our education, grounding, the way we think and the way we work is all the training we got at the institute. And more important, this led to trained doctors in oncology, created a separate specialty of oncology. And these doctors from the southern tip to the eastern tip, north and west and central India, they are all there so that patients in every corner of India can get standard multidisciplinary oncology treatment. So that's the most important thing. Second, everyone knows, you wouldn't know, but we all know how tough Madam is. Well, you can't get as tough as Madam is, and there's no doubt about it. But interesting, every patient who enters her chamber will see the kindness as she touches and the solace as the patient comes out of the room, even though she would have given a very, very difficult information to the family that A is suffering from cancer. This particular quality makes her so dear and loving to all of us. So I welcome my chairman, Dr. V. Shanta, from the Cancer Institute, WIA, to deliver her address.